Okay, so I've got Joe Reynolds on the line. For whatever reason, he's having the same technical issues that I was having with the link. So Joe will join us via cell phone, and he'll be able to answer any questions about the items related to COVID. So I wanted to get everyone together so we could give you guys the latest updates on COVID. As you all know, the space in COVID has been shifting very rapidly. And from the last time that we've met, a lot of updates have come in, and we wanted to provide a space where we could have lots of the questions answered that are circulating out there. So the main themes that we have received, I'll go through those and then we can open it up to any questions. But some of the things that are coming up right now are the testing scenarios that are going to be required for employees that do not have the vaccination in place. So before we get into these kinds of topics, what I want to make sure that we all continue to work towards is keep in mind and keep in perspective and in focus that there are two sides to every issue. And there are some folks that are very much in favor of the vaccines. There are other folks, for many different reasons, have not received the vaccine. We need to be mindful and respectful of those items, but work through the challenges of the requirements that we have at the state level regarding where we are at with these items. So the first item that I'm going to cover is going to be the testing and the questions that have come up from the testing. And like I said, we have Joe Reynolds, who's our system attorney, that will provide any guidance on the information that we'll provide related to the testing. So what we know as of today on testing is that testing for all state employees that have not been vaccinated will be required on a weekly basis. We are working, the system is working to connect to a service that will provide the testing. Once that gets in place, we'll send out that information. It's a pretty slick system that you can use with your cell phone. You can go to the site, you can get back your test. They have two types of tests. One will be nasal, one will be oral, depending on what the individual prefers. Please keep in mind that the oral is less effective than the nasal, but these are not the deep nasal tests. These are the swabs that go inside the nasal and will be used. So the main thing here is that all employees that have not been vaccinated have to have this on a weekly basis. So we're going to go question and theme by area. So any items related to the weekly testing for those individuals that are not tested. One of the questions that comes up with this is, will administrative leave be allowed to be used? The last guidance that we have on that, and Joe, correct me if I'm wrong, is that administrative leave cannot be used for the purposes of getting these tests. These have to be on your time. Is that correct, Joe?
Yes, it is, President Solis.
Okay, very good. So that is a correct statement. So with that said, I'll open it up to this first theme, mandatory testing. Everyone that is not vaccinated will have to have a weekly test to confirm their COVID status, but no administrative leave is allowed to be used. So with that, I'll open it up for questions on this first part of the discussion. So the first one that's come up, is this a requirement of individuals who teach 100% online? So I'll let Joe chime in right after this if there's anything that needs to be said different from mine. But as I understand it, if you're 100% online, then there is an exemption from the testing, but with the caveat that it is 100% online with no coming to campus for any reason. Joe, is that correct?
President Solis, yes, this is Joe Reynolds. That is our understanding from the State Health Department.
So again, if you're 100% online and 100% means you come to campus for no purposes, then that is allowable where you do not have to have the weekly test. If you come to campus even once, you have to go through that process. So any exposure that you have to individuals on campus, if you're not vaccinated, you will have to get that weekly test process going in place. So any questions with that? Let's see. What if an individual is not vaccinated due to religious reasons? Okay, so we'll cover that piece. So on the religious exemptions on the vaccines, and my understanding is that it has to be documented once these discussions go through the state level of requirements. The pieces will be that it has to be documented that you have a religious reason for it. It's not just going to be an automatic check the box. There's a process for it. And then what happens behind the scenes is that the individuals still have to test on a weekly basis if they're coming to campus.
President Solis, this is Joe.
Yep.
Reynolds, if I can add a little context to that.
Yes.
There is not a legal exemption for religious reasons for the testing requirement.
Right. So what Joe is saying is that there is no legal exemption for the testing requirement. There is for the vaccination at this point. You have to demonstrate and document that. But for the testing, if you are on campus for any reason, there is no legal exemption for the testing part of that piece.
And President Solis, I would add that there are forms that we do have that we will be distributing for both the claim of a bona fide religious exemption that's verifiable, as well as a medical exemption from the vaccine requirement.
Okay, so I'm not sure if are you guys able to hear Joe's comments? Yes, okay, good, all right. So then keep in mind, it has to be a bona fide religious exemption, and the testing will be required every week. And like I said, there's a system that's going to be deployed along with the forms that will be deployed to the system employees, so that they can fill out those items if they are seeking the exemptions on those pieces. So I don't see Nikki on here. Nikki usually keeps track of the questions. Is Nikki on board?
I'm here. Yeah, I've been
Okay.
keeping track. There was a question about our student employees included.
As my understanding is that they are. Is that correct, Joe? All employees, whether part-time or student, all are included.
That's correct. All employees, anyone who receives a paycheck.
Yep. The other piece that's really important, folks, is keep in mind the 70% item. There is this clause that says that if we reach 70% vaccination across all employees, part-time student, anybody who's on campus, if we reach 70%, we no longer have to do the tests. We have to monitor that on a weekly basis, but once we reach that 70%, we no longer have to do that. So again, I understand that the vaccinations is a very deeply personal choice, but if you are something that that you're considering, that helps in those metrics. Once we reach the 70%, we monitor that, and we no longer have to do the testing unless we fall below the 70%. We will not find out where we are at for the purposes of the exact numbers until sometime next week. Melody and Eric, and I believe I saw Melody. I'm not sure if Eric was able to get on here. Eric and Melody, are you guys on?
I am here.
Okay, have we seen Eric?
Yeah, I'm here.
Okay, very good. All right, we'll get into those pieces in a bit. But that's the first piece on the testing. Any other questions that have come up before I introduce Eric and his new role with the campus?
There are a lot of questions.
Okay.
How will you know who's vaccinated?
Okay, so we got some updated information today, and I'll let Joe and Eric chime in on this one as well. The state is going to send us a list in terms of percentage of employees that are vaccinated. And going back to Joe's comment, anyone that receives a check will be on that list. But my understanding, as of the training that we received today, we will receive the information via our HR office as to who is vaccinated and who is not within the employee ranks. So Eric and Melody, Joe, do you guys want to add anything different to that?
This is Joe. As you said, President Solis, we are currently working on access to a statewide database called WebIZ that does have all employees who have been fully vaccinated in that list. And so we will have access to that. That information comes from the county, respective county health departments. And so that everyone is assured, it is also still protected information on names. That's why it goes through both our HR departments as well as through legal.
Very good. So everybody heard that in terms of, we will be receiving the list, but it goes through HR. That way we still have the privacy pieces in place. So Eric and Melody, you guys want to add anything different to those items that have come through the questions?
Oh, go ahead, Eric.
Go ahead, Melody.
I was just going to stress that I just wanted to echo the president's statement regarding confidentiality. The information that we receive regarding who has been vaccinated and who has completed weekly tests will not be published anywhere, will not become public information, and will not even be shared very broadly at WNC. Only individuals who have, a very limited number of individuals who have a legitimate need to access that information will be able to do so.
Okay.
I had a couple other things to add as well. So both both Joe and President Solis mentioned the WebIZ, which is a state-run immunization record portal. There can be entry errors in that system. I kind of laughed because as soon as I learned about it, I went and checked for myself and I didn't find myself. So what I'm going to put the link for WebIZ in the chat, and I would recommend that everyone check for themselves to make sure that you can find yourself in that database. If you can't, you can either contact your county, or you can I can put you in contact with someone to get that information corrected. So I'm going to put that in the chat right now.
And to speak to a couple of questions that have come into the chat, the information that we will be receiving regarding vaccinations will be anyone who has been vaccinated in the state of Nevada. We do realize there may be people who received vaccinations outside the state. Those individuals, we will be able to manually update that information when it interfaces with Workday. We can also have you provide your vaccination record to WebIZ and be added to their database.
Yep. The other piece that I wanted to mention is I sent out a couple of notices regarding the new role that Eric York has. Keep in mind that everything related to COVID has happened very, very rapidly. We've been dealing with this issue for a year and a half. I asked and pleaded with Eric to please step into this role. This is not an easy role that he has taken on for us. As you can see in the last couple of days, he's had to tackle several different things that we are working on that are shifting very rapidly. As an example, there's been an emergency meeting call with the presidents tomorrow at 4:30 to kind of gain perspective on some of these changing environments. So as Eric is requesting items or working with you individually, Eric has full authority on my behalf and on behalf of the college to work through these items along with Melody on the HR side. So keep in mind that we are being inundated with different things that are related to COVID, and we're responding as best as we can. We have a small team, but this is why I've asked Eric to take this on. You all know Eric. He's a tenured faculty member, a lot of experience in different areas of project management. But for the purposes of this, we've got a lot of issues coming our way that we are trying to work through very carefully, and Eric will be leading the charge on that. So let's make his job as easy as we can because he's dealing with multiple pans in one fire and trying to work through those. So with that said, other items that we wanted to go over have to do with whether there's going to be fees for the testing. My understanding, Joe, as of the information provided today, that will be covered through the state with the system that they have. Is that a correct assumption on that part?
It is, and while the primary responsibility does fall on financially on the individual, as I mentioned earlier, we are currently working on agreements with the state to have access, as all other state employees, to various testing facilities that will be free, that are located throughout the state.
Very good. Okay, so for now, the state will be covering the cost of the testing. If anything changes on that, we will be sure to let you know. There is a system that will be deployed to all state employees. Joe mentioned that the legals are working on setting that memorandum in place with the state for NSHE. Once we have that in place, we will deploy to our team members so they can use that system. It's matched up to your phone and it's very easy to use. You go to the site, it takes less than 5 minutes once you get registered for the services to test on a weekly basis. So for now, keep in mind, testing is on the time of the team member, but for now, the state is covering the cost of the weekly test. Okay, all righty. Other questions, Nikki, that have come through?
There's some clarification needed on the 70%, whether that's for the campus and does it include adjuncts and that sort of thing?
Yep, and I'll defer to Joe on that one, but my sense on that, from what we understand, is that all employees of the college count in that 70%, with the exception of vacancies. You may have a list of 10, 15 vacancies. Those are not in that count, but anybody that is active in a position, that number counts for the purposes of the 70%. Joe, do you want to add anything to that?
Sure, President Solis. I've also been in conversations with our Human Resource Advisory Council. We are looking and seeing greater clarification if that is just the primary institution location, or is that 70% number also include satellite campuses, or will the satellite campuses kind of be treated as their own space for that 70% rule? We're working on getting clarification. That's a good question.
Yeah, it's a good question. The other thing is, keep in mind, we have sent out a survey. Eric sent out that survey to the college. Please take some time to fill that out. Like I said, it's completely anonymous. And even though we understand that it is not a fully scientific survey, what's important is that everybody understand that we are in the midst of our fall registration. So what we want to do is gain perspective with that survey, because Nikki's team on the marketing side will have to shift resources and do more internal marketing about the benefits of the vaccinations, et cetera. But that way we need to know how much effort we need to put into that at a time where we're spending a lot of effort into the enrollment piece. So take some time, answer the survey. Like I said, it's completely anonymous, but we just want to get some perspective on how many people on campus are vaccinated, and we'll go from there for the purposes of marketing. And then by next week, we should have the official count from the system, from the state, on who is actually vaccinated and who is not by employee count. So we'll have that information next week. Other questions, Nikki?
There's a question about medical information, stating that medical information is private and asking how this is legal.
So Joe, the question is the use of medical information and how this becomes legal, or how this is legal. This is more of a legal question. Anything you want to respond on that piece? Joe?
I apologize. I was on mute. It is legal, and I would say our United States Supreme Court for over a century has upheld the authority of the government to impose vaccinations, and this is personnel information that is kept. Attorney General's office has vetted this, and I have as well.
Okay, so did you guys all get that information loud and clear from Joe? It's legal. It's been vetted by the powers that be on the legal side, along with the Attorney General's office of the state. So this is what we're working through on these items. Before we get into the next item, I wanted to turn it over to Eric so he can talk a little bit about his role, and more importantly, a form that he's been working to develop to track some of these items. Eric, you want to talk a little bit about that? You're on mute, Eric.
Yes, it helps if I unmute.
Yeah.
Sorry about that. So we got together with Troy Wadsworth and Melody in HR to develop a secure database, basically with an online form where people could submit both proof of vaccination and testing tracking. We just learned today of this database that will be statewide that will help us to do all of that. And so right now it's not, this is literally fresh off the press. So right now it's not really clear that we're going to need that tool. I think that Kim asked a really relevant question, and that is, in the name of expediency, can we just, if we're not finding our record in WebIZ, can we just submit it to HR? To be honest, I don't know the answer to that, because I do not know whether we will have direct access to update those records in the state system, because this will be a statewide database. Melody, do you have anything to add on that?
Yeah, my understanding is that we will not be able to update WebIZ, but can refer employees to WebIZ to make corrections or get added if they're not added. What we may do, and again, this is developing, like literally Eric and I learned of this a few hours ago. So, however, what we may be able to do is have you bring by your vaccination card, or perhaps use the form that Eric has worked with Troy to develop to sort of be as a Band-Aid solution to be exempted from the weekly testing requirement until your record is updated with WebIZ. But ideally, we would have you update your record with WebIZ for the long term, as we'll be getting weekly reports from them. So it'd be something we wouldn't want to be correcting on a weekly basis.
And this is Joe Reynolds, to add on what Melody and Eric stated. Certainly the intent is for it to be accurate. Both of our major universities in Nevada, UNLV and UNR, already require student vaccination proof as a condition to register, and that's for some of them are quote traditional communicable diseases, meningitis, rubella, diphtheria, tetanus, and so forth, or not tetanus. Excuse me on that. Mumps is what I meant. And so that is already done. And as Melody indicated, if an individual doesn't find themselves for whatever reason in WebIZ, and Eric stated it's not a perfect system to bring in proof or verification or that card that many were issued when they completed that vaccination, and we can work on updating that and making sure that you're not penalized.
Okay, so multiple ways that we can get that information updated. I think Jeff just posted some items that they were able to correct it on his WebIZ, but needs to check back. So there is a way to do that, and we'll send out that information so that folks can start getting that those items in place. Nikki, other questions that have come through the chat?
Before we move on, I'm sorry to interrupt.
Go
Before we
ahead.
move on, here is where you can contact the WebIZ help desk and a phone number where you can call to correct any errors that there might be. If you do not find yourself when you go into that database, it's likely because there's some error in your record, and you can either call or go to that website.
Okay, any other items for Eric or Melody on those items? Nikki, other questions that have come through?
We've got a couple questions just verifying that if an employee is 100% remote, that they do not need to get vaccinated.
Okay, so the question, Joe, if an employee is 100% remote, the question is if they do, they would not have to be vaccinated. Is that correct?
Yes, but I would say that with an asterisk or the slight caveat until kind of the final policy is in place, and that I would my yes is that's my understanding, but want to see a final clarification from the state on that.
Yeah, and keep in mind, folks, that what Joe is mentioning is that we are dealing with almost up to the minute changes. So as of right now, if you're completely 100% remote, the need to be vaccinated is not there for the purposes of meeting state requirements. Keep in mind that if you come to campus for any reason, then at that point, you're no longer considered remote and you'll have to work through the vaccination process. But please keep in mind that on September the 3rd, which is when the State Board of Public Health will meet, they're going to take up the issue of vaccinations. Things may change based on the final policy that comes out of the state. It may be different from what we just indicated. So what Joe stressed is that, yes, that is correct for now, but if that changes, we will be sure to send out the information to the employees across the college as soon as we know it. And please keep in mind, again, going back to the items, whatever information that we have that Melody and Eric are gathering, that is being sent out as it comes in. We just went through a training at 1 o'clock, and there were a lot of really important updates there and changes that they'll be having to work through. So again, keeping in mind that this is a very fluid situation and we are monitoring it very closely. Like I said, now we've got a point person that is working directly with all things related to COVID, and we know as soon as we know, you guys know. So keep those items in mind, please. Other questions, Nikki?
If someone is not listed on WebIZ, can they work directly with HR?
Melanie?
No, at this time, we don't yet have access to WebIZ, and my understanding is that once we do, we will not be able to change those records. So we need the employees to contact WebIZ using the information that Eric provided, or I also understand their county may be able to help them get that corrected. But in human resources, we will not be able to modify the state's vaccination records.
Okay, so the modification of the state records falls to each team member. Is that a way of saying that, Melody?
Yes, we need each employee to work with WebIZ or their county to ensure their information is correct.
And keep in mind, folks, we encourage you to do that and check your status as soon as you can. This way, once Eric and Melody start focusing on the testing piece as to who is not vaccinated, that way you're not on that list, okay? So it'll be important once we get that information that you've already double checked your status with WebIZ. If not, the report that Melody and Eric are going to get is going to list you as unvaccinated, and the testing requirements will have to go in place until we get that squared away. So please double check your status on the information that was provided by, I believe it was Eric and Jeff that posted that on how to reach WebIZ. Okay, other questions, Nikki, or themes that are coming in?
So there was a question about whether remote employees are calculated into the 70%.
Joe, that's a good question that I've been hearing, Joe. I don't have the feedback on that. How do the remote employees, Joe, how does the state know who's remote and who's not in terms of the 70% calculation?
The state right now wouldn't know, who's been granted remote status or not. Something that is important is to know that remote work is not necessarily a way out of the testing requirements, and that evaluations on working remotely is independent of the current pandemic requirements. Because working remotely won't necessarily subject an employee to the current testing or any future vaccination requirements, I imagine that they would not be counted one way or the other in terms of the 70%.
Okay, so the answer to that in terms of the response is that for now they are being counted in the equation. So for that reason, it's really important that if you have not and you're open to receiving the vaccination, please do so. And I believe, is Craig on here? Craig, are you here?
Yes, sir.
Craig, when is the next vaccination event taking place on campus?
September 17th.
So September 17th, there will be a vaccination event here on campus.
No appointment, your choice of manufacturers.
Okay, so Craig will be sending out a little bit of information on that. But even between here and there, that's a couple of weeks out. You still have opportunities, many locations across the Quad counties that are offering vaccinations, and you can get those scheduled and taken care of. Again, keep in mind that the goal here is to keep everybody safe, but we also understand that vaccination, for many different reasons, is a personal choice. We want to encourage those that are still interested in receiving that, but we also understand that there may be some hesitancy on the part of others to receive the vaccine. So we just want to make it very clear in terms of what the steps will be. Our goal is to get to 70%. Keep in mind that Nevada is just at above 50%. So I don't know if we'll be at that 70%, which would preclude us from the test. But if we get to that point, we will definitely be sure to inform everyone that the testing will cease, at least for that immediate period, that we're in that 70 percentile mark or above. But right now, we don't have a ballpark figure until next week of where we're at with the vaccination levels. Okay, other questions, Nikki?
I don't see any new questions. I don't know if I'm missing something.
Okay, Eric, any of the
I
other
see
things
a
that have come?
few that I don't think have been addressed yet.
Okay, they were moving fast at one point, so I may have missed some.
Yeah, there was a lot coming in. Will employees who are 17 and younger have to get a COVID test? I think we have some student employees maybe who are 17 or under.
So Joe, the question is, what happens with employees that are 17 or under some of the work studies?
My understanding is yes.
So the answer to that you guys heard, Joe, is yes, they are subject to the same requirements.
And I would add to that, President Solis, is the underlying policy, again, is to not allow any employees into any kind of workspace if they're unvaccinated and don't have a weekly COVID test, because it's the intent is to capture anybody who is positive, and that includes student workers.
Okay, so student workers are included in the policy. They have to follow the same guidance. Other items, Debs, that you saw in there that weren't addressed?
I'm scrolling.
Here's one. What's the supervisor's responsibility with tracking and testing vaccinations?
Well, responsibility to the supervisors, Joe, my understanding is that this is responsibility of the employee that will be tracked through HR and through Eric's office. So is that a safe assumption, Joe?
Yes.
Yeah, so it doesn't fall to the supervisor, that falls to the COVID response team led by Eric and Melody through HR. They'll be reaching out to those employees.
And then here's a question. If your name is not on the WebIZ, even if you have been vaccinated, you will still need to weekly test?
Well, if the name is not there, the first response should be to fix that piece. That way it's not on there. But if the documentation doesn't come through, it defers to the testing. So the first step would be to make sure that your record as an individual is up to date and correct so that it doesn't fall into that testing. But until it gets cleared on WebIZ, there's no way for us to know if a person has been vaccinated or not, unless they have other documentation that could be used in lieu of, that could be used to then modify the WebIZ. Eric, does that pretty much sum it up? Yeah. Okay.
And then Robert Drews asked a question about guidance that is not acceptable to switch to remote from in-person.
Right. So we've had a lot of questions about that. And keep in mind that we've got two priorities. One is keeping everybody safe. Two is keeping the college open. Northern institutions are right now suffering some pretty serious enrollment losses. So the priority right now is to keep the schedule that has been in place and has been set in place for the fall semester. In the event that something changes in terms of a closure or something else that may come our way, then we'll fall back to that plan. But for right now, the plan is, and the directive I provided is that if you are slated to teach in person, then those schedules stay as is, so that we can make sure that we work to meet our enrollment challenges that all the Northern institutions are facing right now.
Okay, here's another supervisor question about whether supervisors will receive confirmation that employees are eligible to work.
So Melody and Eric?
Yeah, so right now the guidance is that while employees may be waiting on their weekly test results, they are able to work. However, all of the CDC guidelines are still in place. If someone is sick, they should not be coming to work. And then if they eventually receive a test result that is positive, then the self-isolation guidance comes into play. So simply the fact that employees are requested or required to test weekly and may be waiting on results does not preclude them to come from work in the meantime. So supervisors, it's not like we'll be sending you a weekly report of who can and cannot come to work. You will operate under the assumption that your employees will be able to come to work. You won't have to be waiting on approval from us. The only time that changes is if employees are symptomatic or positive, which has been the case all along. So that piece does not change.
So Joe, a question that I see in the chat that I've also heard from different sources is, if the record is not reflected correctly on WebIZ, can they use documentation that they have had the vaccination in lieu of until the record at the state gets fixed? I'm assuming that the answer to that would be yes, if they can demonstrate that. Is that correct, Joe?
That is correct.
Okay. Yeah, so if you have documentation and it's not yet uploaded or that isn't correct, we'll still be able to work with you on that. And then while we're working at the same time with the individual to get them the information they need to make the changes so it reflects at the state level.
And several people have put into chat that they're trying to contact WebIZ and learning that the voicemail box is full. But please also know there is an email option as well that Eric has put in the chat. And Eric, it might not be a bad idea for you to put that in the chat again, or even send out an email. The phone call and leaving them a message or speaking to someone in person is not the only option for getting your record corrected with them.
Thank you, Melody. Other questions?
Yeah, here's a question. What are the requirements for vaccinated people as the Delta variant is able to transmit and spread through the vaccinated per the CDC?
Okay, so can you repeat that again? So we
Yeah,
understand.
I'm not sure I understand the question. It's from Dusty. So Dusty, do you want to elaborate on that?
Yep. Is Dusty here with us?
I'll just read it again then.
Can you?
Oh.
There we go.
Okay.
Yes. been several reports coming out of the CDC that the vaccinated are able to both transmit and spread this new Delta variant. So why are the vaccinated not required to test as well?
I think, and I could be wrong, I don't know, we have any of our medical experts from the task force with us today, Dusty. I believe, and again, don't quote me on this, other than this is the feedback I can provide from at least what we've heard with the medical experts, is because if you're vaccinated, the rate of catching it is extremely low. So I think that may have something to do with it. Joe, is there anything you want to chime in on from the task force? I know that we're not the medical folks, but the medical folks have told us that a big part of it is that those that are vaccinated, have a very low percentile of catching or getting a breakthrough case. It's the folks that are unvaccinated, where the Delta variant is 3, 4, 5 times, depending on which report you're looking at, more contagious, and that's why it's spreading so quickly. So I think that that's a part of it. Joe, anything you want to add?
Yeah, that's correct, President Solis, and with our NC task force and the doctors and the experts that are on it, I think specifically to answer the question is, far less, than 1/10 of the individuals who've been fully vaccinated are ending up in our ICUs or resulting in death. Rather, the current spike that we're seeing in the surge is for unvaccinated individuals. So it's still possible that people who've been fully vaccinated can get COVID, and then they might get mildly sick, but they will not, the odds of them ending up in the hospital or dying are extraordinarily remote. And so the purpose of this really is to protect the unvaccinated while giving them further opportunity to become vaccinated.
And keep it. The other question that's related to that I've heard has to do with the variants that are out there. So it kind of goes back to these pieces of those that are vaccinated. The levels are very low. That'll respond to those pieces in terms of getting really sick. Not to say that there aren't breakthrough cases, but the levels are just very, very low at this time. So it really is a matter, as Joe indicated, of the protection of the individuals that are not vaccinated. And again, for a lot of different reasons, folks go through that. So that's a good question, Dusty. Thank you for adding that.
And I'd like to add from the training call, the statewide call that Eric and the president and I believe Joe was on as well, the call that we were on today, this was framed from the governor's office as a vaccination effort as opposed to a testing effort. So I think that is part of why the testing is not required for those who are fully vaccinated, because again, they're not trying to get more people tested. They are trying to encourage people to become vaccinated.
But by definition, those that are not vaccinated do not want to be vaccinated. Those that are vaccinated have no fear if, as has been stated, there is no worry for them to catch or transmit the disease. So, no, not really.
Well, it's catching the item, Dave. The transmittal is there, as Dusty indicated, at least from what we're hearing from the health experts.
Then they should be tested as well. If they're transmitting it, they should be tested as well.
Yep. And again, those are at the state level, Dave. We don't make those decisions. We're just following and trying to keep up with the protocols. And we understand that there are strong feelings on all sides of this. Our purpose is to get through this by meeting what the state has for the pieces that they're asking are in compliance, that we are in compliance with.
And remember that all of us are wearing masks, which also reduces transmission by both the vaccinated and unvaccinated.
Thank you, Doc.
Which just makes this a more punitive measure against the unvaccinated.
Yep. And again, Dave, like I said, we understand that there are strong feelings on all sides. For the purposes of the meeting today and what we're working on, this is about complying with state requirements and mandates so that we don't deal with the other issues that come with not following those pieces. Other
So
questions?
I've got a quick follow-up
Dusty.
on that.
Yep.
Say we do come back with a positive test. and we have to isolate at home. Does administrative leave cover that?
Joe, any feedback on that question?
No, it does not.
It
You
does,
need to be on sick leave.
so it does not, Dusty. The response that we're getting is it does not, and you have to go on sick leave.
Another
So-
question, if I may, along those
Oh.
same lines.
Okay, we got Dave. Dave, if you can ask the question, Dave, then Dusty
Yeah.
will get right back to you.
So along those same lines, if somebody tests positive, isolates, they have now natural immunity, are they still going to be required to test and or vaccinate?
Yep, the same processes remain in place, Dave. But keep
So
in mind,
natural immunity is not acceptable in lieu of a vaccination?
not at this time, and keep in mind that every human being is different and the immunity levels are different with everybody. So the virus is going to do what the virus.
That
is
would
gonna
play
do.
with the vaccine as well, Vince.
Well, I get it, but again, Dave, the purposes of what we're doing is following and making sure that we are in compliance with the state, whether we like it or not. And that's what we're going to continue to do.
I have a response to that.
Doc?
With coronaviruses, they actually suppress the immune systems. So I just talked to my buddy who's a department chair of molecular biology, immunology, and he said the coronaviruses, they actually suppress your immune system. So even though you do have some immunity, the vaccinated immunity is higher than if you get it actively, because they're famous, those cold viruses are famous for suppressing immunity. So you do have some protection, but not as good as vaccination immunity.
Fair point. Okay, Dusty, you had a question, Dusty?
Yeah, just going back to the administrative leave, if you contract it from somebody that is vaccinated, not showing any symptoms, although they can spread it and it happens at work, that is a workplace incident. So how is administrative leave not approved for that?
Well, I could be wrong on this and I'll let Joe chime in, but my understanding, Dusty, is that there isn't a way to prove that it happens at work. Keep in mind that folks are exposed at every level, grocery store, gas, running errands. If you're exposed to human beings of any kind, particularly even children who are not getting vaccinated, there is no way to pinpoint where someone contracts the item. The levels are just too high across the spectrum of humanity to pinpoint where someone catches it. And Joe, I don't know if you have any other feedback on that, but at least those are some of the discussions that we've had at the task force level.
I'd like to
Yeah,
comment.
this is Joe, and the rationale is this is like other communicable diseases. If somebody got the measles, they would need to quarantine and not go to the workplace, and they would use sick leave as opposed to administrative leave.
Craig, you had something you want to add, bud?
Yeah, I'd like to comment on that from the OSHA perspective. Nevada OSHA has recognized COVID-19 as a workplace hazard, not much different than welding fumes or asbestos dust, which means our office would be obligated to do due diligence to at least see if Dusty was correct in that he got it on campus, and he would indeed be still eligible to put in a workers' compensation claim if he could prove with some reasonable evidence that he contracted COVID-19 in the performance of his work. So there is some level of correctness in what Dusty said.
I just, there's an important distinction to make on that, in which case it would go the route of a workers' compensation claim as opposed to administrative leave kicking in.
Correct.
Yep. Joe, anything else you want to add on that piece?
Sure, President Solis. The directives do have the force and effect of law, and so this is the law, and and what was passed also by the legislature last summer during the special legislative session, what's referred to as Senate Bill 4, also requires INCHI to be in full compliance with all local, county, state, and federal laws and policies regarding COVID-19. Otherwise, civil immunity is lost in those instances. So this will be strictly enforced.
Very good. Nikki, other questions that have come through?
Yes, there's one that's, if an adjunct gets a positive test, they can isolate and convert to online web classes. Will they be allowed to do so?
Yeah, we're gonna deal with those on a case-by-case basis. Let's hope that none of us get sick, but yeah, if it happens, we're gonna have to deal with those on an individual basis. Kyle, anything you want to add to that?
Nope, we're working on having the backup technology in case we need it for cases like that.
Yeah, similar like what we did last year. Other questions, Nikki?
I don't see any new questions, unless I'm missing something.
I think Amanda put in something.
I just submitted it,
Yeah.
just now.
You want to clarify on that one, Amanda, so we can work through that?
You know what? I can't really clarify because they were chats that came into me during this meeting, but one says, how does that protect our sensitive families at home, especially when we have positions that are not easily permissible to work from home? And I think that was going back about 5 minutes when we were talking about people being required to come to work and then going back to their families and the whole vaccination part of it. The second one is, with an appointed director of strategic COVID response, is that who we report to for non-compliance from students?
So on the second piece, we'll work with each student as an individual case. Obviously, Eric will be involved in all things related to COVID. With most students, it's a matter of, put your mask on, stay in compliance, et cetera. Fortunately, we didn't see many issues with that last time around. At least going back a year and a half. So we'll continue to monitor that very closely. And on the first one, I'm not sure what exactly the question is in that, Amanda.
Yeah, I was just sending the chat that I got.
Gotcha.
Yeah, it went back about a few minutes before it was sent.
Yeah, and I think, on the protection of the family, and again, I understand that these are personal choices, but the best protection we can get are the vaccines for those that are interested in receiving them.
President Solis, if I could jump in here, we are going to be providing some guidance for faculty members for what goes on in the classroom. If for some reason you have a student who is creating a conduct issue related to masks or any other issue. So that'll be forthcoming in the next week or two.
Okay, very good.
We do have one more question that just came in.
Yep.
In the event that an employee has not done their testing in a timely manner, what happens if the results are not received? Are they not allowed to come to work? How will departments handle being down a person if that happens?
My understanding, and again, there was a lot of discussion on that today. Melody and Eric, you can chime in on this, but these results are pretty instantaneous. Is that correct, Melody and Eric?
The result, yeah, we're not anticipating a large delay on results. I kind of want to answer this question in two parts. The first piece of that was what happens if an employee is not tested timely. And our guidance is very clear that we will be following progressive discipline so as to maintain our immunity under the state. If we do not follow and enforce this directive, that becomes jeopardized. So we will be using progressive discipline to address employees who are not compliant with this directive. The second piece of that, Coral, was if there's a delay in the test results, again, employees will not be off work awaiting test results. However, employees who have symptoms should not come to work, and employees who receive a positive test should self-isolate according to the CDC guidelines.
Yep, and at least from what they said today with the testing company that is being looked at the state level, the results are pretty instantaneous, a couple of minutes from what we understand. So just some things to consider. Also keep in mind that the two types of tests that will be available, one will be nasal, one will be oral. Most employees, automatically, we think of let's get the oral because it's the least intrusive, but it is less accurate than the nasal swab. And now again, these are not the deep, the deep tests like they were originally. These are just very general swabs in the nose, but they're more accurate than the oral. So that as soon as we get more information on the testing part, we're going to send that out because we will have the locations available along with how you can track your progress and link it via your phone. Other questions, Nikki, anything else come through?
I don't see any new questions.
Okay, Joe, Eric, Melody, any final comments for the group from your respective areas?
Excuse me, I just wanted to make one comment about the question regarding non-compliance from students. In most cases, if there's a student in a class who's not wearing a mask, you can just ask them to wear one correctly. If you have a student who is repeatedly either causing issues or simply refusing to wear one, current guidance is that you call campus security. We definitely need to stay on top of this. In 99% of the cases, it's a very good-natured, hey, can you put a mask on?
Right.
If anyone is concerned about this or is having consistent problems, I would encourage them to contact me ASAP, and we can develop a strategy to deal with it outside of the instant response in the moment.
Thank you, Eric. Melody, anything from HR?
I don't think I have anything else to add, but I'm still free for any questions that may come up.
Very good. Joe, anything from legal?
No, President, other than, unfortunately, none of us thought we would be here 2 months ago. And so just emphasize both patience and compassion for everyone involved.
Yep, and couldn't say it better myself. Thank you, Joe, for your words of wisdom on all things related to COVID and legal issues. I want to just close out the meeting first and foremost by thanking everyone for being here today. We understand that these are important topics that everyone has a very vested interest in. I want to make sure that we continue to work towards safety and keeping everyone healthy. That's our top priority, and we want to make sure that we comply with those items. At the same time, I understand that this is an issue and a topic that is very polarizing, and folks have different opinions about it one way or the other, and those are strong opinions. What I expect from everyone on the college is that we always treat each other with dignity and respect, and keep in mind that people don't walk around with a giant billboard that explains why they do or they do not do something. So everybody has different reasons for receiving the vaccine or not receiving the vaccine. We obviously encourage everyone to stay safe and consider getting the vaccine. But for those that don't, what I don't want to see the campus become is those that are vaccinated versus those that are not. Again, everyone has very deep personal reasons for either or. And I want to make sure that respect and dignity and that we treat each other and continue to take care of each other is always top of mind. Right below that is keeping the college open. Keep in mind that these are very trying times. We're going into the enrollment count year. And while we understand that we're dealing with a swirl of things related to COVID and keeping everybody safe, I think Joe said it best that 2 months ago, we didn't think we were going to be here at this point, but here we are. Things change by the minute. Tomorrow we have another meeting with the presidents at 4:30 and Joe. Things may change tomorrow afternoon, but as always, with any information that we receive, we will send it out to the campus. You know what we know. We send everything out. The second piece is, you ever have any questions, you've got Eric as a resource, you've got Melody as a resource. You can contact myself, you can contact any of the VPs. We try to keep the flow of information going. I know I send out lengthy updates to the campus. Not everybody reads all the emails, but this is why we have these secondary levels of communication so that people can ask questions, get the information that they need, and discuss these important items. But above all, please continue to take care of yourselves, take care of one another. And thank you for everything that you do and for being here today late in the afternoon. So with that said, we're closing this one out today. We'll be around if anybody has any other questions, but I do want to thank you for being here today. And again, continue to take care of yourselves and each other. Thanks for all you do.